Hello friends, previous class we studied the health and diseases. So different types of disease in previous class we study. For example, cancer disease, yes, rabbits, yes, diabetes, reason of that, symptoms of that. AIDS is a also disease. You can study the symptoms of that. Okay. So today class we will study the next types of non-infection disease is the heart disease. Okay, so what is the heart disease? If you decrease the blood supply to heart or oxygen and nutrient, so what will be happen? Yes, so heart will be higher working or not working. Okay, so that is the reason to heart attacks. Is it heart attack? Is it? So what is heart disease? So these are the different types of heart disease. So efficiency of heart decreases due to the decrease in blood supply. Okay. So what is the efficiency? If you suppose a blood supply is decreases, so obviously heart need to more work on that, and that will be their efficiency will be decreases. Is it? Means their working performance will be decreases. So what will be reason for that? And thereby oxygen and nutrients supply to the heart also. So what will be result of that? Heart performance is decreases, then your muscle get less number of oxygen and nutrient also. So your function of body is also decreases. Is it? Yes. Due to this, heart has to perform more work that lead to stress on it. So what will be happen? They want to the body the regular oxygen and nutrient also, but due to this condition, heart not properly give the oxygen and nutrient to our muscles on body. Is it? So what will be their reason? So they want to the more work on that, because body need to that oxygen, that much amount of oxygen to is fixed. But if you less amount of oxygen, so that heart working more faster, so that will be stress on the heart. Is it? So what will be happen in that? In this may be gas heart attack. Okay, so this may be heart attack. So that will be attack on heart due to less supply on oxygen and blood, so that maybe cause a heart attack. Okay, if someone has a heart attack, immediately consult of doctors and treatment is necessary. So whatever be different types of stages of heart attack, you know that, or if you search on the internet, first stage, second stage, third stage, like this one. So that will be depend on the patient's situation and their health. So okay, so if the patient suffering or anyone suffering a heart attack, immediately consult a doctor and treatment is necessary. Okay. So always remember, each disease has specific scientific reason. Diabetes do not occur due to the divine. Okay. So that was it. Yes. So one should not ignore the symptoms. Which one symptoms you not ignore in nerves? Which one? Severe chest pain. If your chest pain have left side or right side, which one chest pain? Where is your heart? Yes, left side. So whatever be chest pain in left side or right side, you never ignore. Okay, pain on shoulder. Pain on your shoulder. If the shoulder pain, you can check that. Okay, with help of doctor. Go to the consult from doctors. Okay, neck and arm, charms, hand, weakness and tumors. If you're feeling a weakness sometimes, in between they are working, so you can check your all body platelet or your heart working or plus rate. Okay, so that will be normal or increases, that can be inform the doctor to you. Okay, so what is the reasons of heart attack? Reasons of heart attack. Which one? Smoking. Okay, smoking is very dangerous. Okay, Alcoholism also is a bad habit, and that will be increase in heart attack possibilities. Diabetes, hypertension, obesity, lack of physical exercise. If you're not working or many hours, or if you not properly exercise daily, your body will be not working properly, or you will be suffering from different diseases. Heredity, mental stress, angry and associated. These are the reasons for heart attacks. Okay, heart attack. Okay, so um, if you someone want to the avoid this, so you can use exercise, don't drink alcohol, don't smoking, don't take tension, use a regular exercise. These are the some um, way to avoid the heart attack. Okay, so here is a graphical representation of heart disease is that. So heart disease, if you some patient or some person have heart disease, so heart is a transplant. First one is a installation of stents, installation of pacemaker, heart, open heart surgery, bypass surgery, anesthesia. These are the some information related to the heart. So always you remember, uh, whenever the patient is or suffering or anyone for heart attack, you call 108. What is the 180? Yes, is the ambulance call free numbers. Is it? First call 108 for ambulance. Check the consciousness of patient by shaking their shoulders. Patient are conscious or unconscious. You can check their, how to check it, checking their shoulder. What will be keeping the patient lying on the back of the horizontal position in the where, like this. Okay, horizontal position in the ground or hard surface. Okay, hard surface, and perform the compression only, life support. So you can perform the compression, means you can press on their chest or your back shoulders. Okay, in this, press the center of thorax for at least 30 times the rate of 100 to 120 stroke per minute. So that will be their consumption rate. Okay, so collect information, like this. Have you ever seen your grandparent taking decoctions, discuss about with them? So are you seen that if your grandparent taking decoctions, if you see that, you can discuss with your grandparent. Okay, next is collect information from grandparent about use of aloe vera, turmeric, ginger, garlics and our medicine. So these are the some types of ayurvedic use, daily use materials, but these are ayurvedic. Okay, so you can ask your grandparent, so what is the use of that, which one, aloe vera, turmeric, okay, gingers, garlics. So what are the, they are the use of that. Yes, so you can ask your grandparent. Okay, so internet, from internet you can collect the information, collect the information about a different method of treatment like ayurveda, chemotherapy, natural healing, allopathy and unani. These are the different types of treatment in available nowadays. Next is the misuse of medicine. So are you have know about that misuse of medicine? Yes, misuse means if you over times or many times use the medicine, so it will be harmful our body, harmful our part of our body. Okay, so that will be very, yes, that will be difficult to next generation and also from the older ages. Okay, so that will be avoid misuse of medicine. So what are the misuse of medicine? Okay, so let's check. Sometimes some people take a method without prescription of doctors, but nowadays is not available because of corona. Without prescription of doctor, anyone medicine consult not given to you medicine. Which one? Cough, fevers, okay, coldness. That medicine is not without prescription of the doctor. It's good now. Okay, so overdose of medicine may affect our body. So overdose of the medicine, whatever be made overdose will be affect our body. So medicine overdose also affect our body. So what are the overdose example? overdose of painkiller. Okay, so if you some person feeling from the headache pain, body pain, teeth pain, leg pain, hand pain, different types of pain, so that will be person killing uh, affect the painkiller, is it? So they use a painkiller, overdose of painkiller. My body is paining, my head is paining, like that, is it? So overdose of painkiller may damage your nervous system. It's very harmful. If your nervous system damage, your digestive system is not working properly. Okay, so extraction system also harmful. Liver also effect on the overdoses of the painkiller. So don't use the painkiller. Okay, use exercise daily, do exercise, make fitness our body. Okay, overdose of antibiotics also overdose taken some persons, and that will be lead to ansia, stomach ache, dysentery, rash, white spot, and tongue, etc. So many harmful of so many diseases, a bad effect on our body. So don't use misuse of the medicine, means don't overdose the medicine. Okay, so next, think about it. What do you think about it? Poor people do not offer the costly medicine. Is there any alternate for this one? Yeah, there is some different types of government scheme. Yes, which are the government scheme? You can study on that, or you can ask your parent. Okay, so there is a different government scheme that are the available for poor person, that are not offerable the costly medicine. Okay, so next is, yes, next is the generic medicine. Generic medicine means what? There is a general types of medicine, or a very important medicine, or that's the very low cost but high branded value. Okay, so that is a generic medicine or general medicine. Okay, generic medicine are also known as a general medicine. Okay, these are the manufactured and distributed without any patent, means that they don't have any proper patent. Patent means, what is a patent? Patent means some of the person work on the some medicine, and they got their patent. So without that person permission, you can't sell this. Okay, so that person maybe ask for lot of money or lot of their fees. Okay, so that will be costly medicine. So without patent medicine is a generic medicine. Okay, these medicine are the par in quality. Okay, without that, with branded or branded medicines. Okay, they have the very good quality and branded medicine also. Production of this medicine is very low, so production cost is also very low. Why? Because of they don't have any specific patent on that medicine. So they have the good medicine, but they don't have the specific patent. So patent means already patent cost will be reduced, so that will be production cost will be low. Okay, due to favor expense of the research on their formula is already available. So there is formula means the, if patent is means what is patent? Patent means someone person discover the specific types of medicine and given to their formula. Okay, and according to that prepare the medicine. Okay, but here is a generic medicine, already formula is available, and that will be low cost. Okay, that's why it is available in areas. Okay, so next is lifestyle and diseases. So very important nowadays, the corona situation, you know about that. What is the lifestyle? Yes, very change in your lifestyle, is it correct? So what are the changes in given here textbook? Let's study there. Okay, lifestyle include the daily routines and the types of food. Okay, so daily routine will be obviously your daily routine which tells you don't come to school, your parent or anyone should not go to the work, is it? So that will be daily routine obviously changes. Okay, food type, eating of food is also changes. You go to don't go to the restaurant outside your home. That are the food changes. Nowadays habit like staying in bed till the late morning, you are also, because no school, so you are the still in bed up to 9 a.m., 10 a.m. Okay, someone 11 a.m. not watching any or not doing anything, is it? So that is the late morning and going to the bed late night, you are using mobile, you are watching a TV late night, means 12 p.m. or 1 a.m. like that. Okay, you are the watching TV means late night, that is also bad habit. You don't go to the uh, bed night late night. Okay, you at least 9 p.m. or 10 p.m. is just sufficient for go to the beds, and morning, early morning you wake up is very good for our health. Okay, so next, frequent change in the meal timing. So it's also changing your meal timing, is it? So if you early morning not wake up, you wake up at 10 a.m. or 11 a.m., so the meal timing also changes. Okay, so that will be affect. Lack of physical exercise you are doing, because you are not doing exercise, it's a very bad, harmful our body effect. At least do according to your capacity, do the daily exercise. Okay, consumption of junk food, so don't junk food consumption. Okay, etc. have been increased due to this. Such people are getting sick frequently. So there are the some bad habit, day night sleeping. Okay, late morning wake up, that are the some uh, different types of meal timing changes, frequency time changes. So that will be some habit of you. So that will be what will be happen, those person sick frequently means regularly after 1 week 2 week, that frequent suffering from different types of diseases or some sickness is there. So okay, so that will be our ideas. Okay, if frequency of become sick is to be lower, people should follow the right lifestyle. So someone people or someone the where they do regularly exercise, do medicine, do early morning wake up, and they late night is not sleeping. Okay, regularly meal time, specific time. Okay, so that person lowering in frequency of sickness. Okay, so that is a very good or right lifestyle. Okay, it must include, what will be include that, sufficient sleep important. First one is at least 6 to 8 hours sleep is there, is important. Okay, so sufficient sleep, right food, use the right food means right proper diet balance you eat your food. Okay, next is the yogasan, pranayam, physical exercise. Okay, so that are the some avoid to sickness, you can use this. Okay, and yogasana and pranayam you can use a physical trainer. Okay, that need to use. Okay, pranayam and yogasana should be performed under the expert supervision. See the videos of pranayam and yogasana in YouTube or in yes. Okay, so next point is that vaccination. What is the vaccination? You have a vaccination. Yes, when you are in small, that time your parent given to you vaccination. What's vaccination? Vaccination means to provide that. Right now waiting for some vaccination, is it? Which one? Corona. Okay, so that is the corona vaccination not available till yet. Okay, maybe available in next or some days or month. Okay, fine. Vaccination is important to prevent the infection disease. So what is the importance of vaccination? Before coming a disease, vaccination you taken that, so you not suffering from that diseases, or person is not suffering from the disease. That purpose vaccination is very important. Collect the vaccination schedule chart from the nearby clinic and study it. So different types of 6 for 3 months, 6 months, 12 years, like that. So vaccination different doses and different, that is BCC, like this one, that is okay. So that will be vaccination type is there. Okay, so you can collect this information for your near to the hospital and use that. Okay, next uh, do you know, you can read that. Let's celebrate the health awareness day. 7 April is health World Health Day is there. 19 September is World Heart Day is there. 14 June World blood donation there, and 14 November World Diabetes Day. Okay, so in today topics we study the heart diseases. Okay, heart disease means heart attack. These are the first heart diseases there, due to the lower in decrease in blood supply to the heart, and oxygen also to muscles, and nutrient is also to muscles. After that is a you can study the misuse of the medicine. What is the misuse of medicine? Overdose of the medicine. After that you study what? You study the generic medicine. What is that? Generic medicine without patent medicine is the generic medicine. That lifestyle, after that lifestyle and diseases, different type lifestyle have the diseases according to, yes, situation of the, so that will be studied today. Okay, fine.